Hi, everyone. I'm Kate Walsh, President and CEO of Boston Medical Center. I was asked to share a personal experience with COVID-19. At first I thought, well, other than the indignity of being firmly at risk due to my age and other factors, I wasn't sure what personal experience I could describe. I was, however, awash in professional experiences. Our health system at Boston Medical Center had worked around the clock and moved mountains to respond to the COVID-19 surge. I've worked in healthcare for over 40 years, and this was the most challenging situation I've ever dealt with. And the challenges continue to this day. But as overwhelming as it was still basically a professional experience, not a personal one. But then I remembered one event that stood out. Although work-related, this was a profoundly personal moment that crystallized in a nanosecond the profound safety concerns, especially early on in the pandemic, that I was hearing from my colleagues at Boston Medical Center. Our hospital disproportionately serves low-income patients, including many patients experiencing homelessness. As we expected, our hospital surged early. We found ourselves chasing space, staff, and personal protective equipment. Our community partners also turned to us, community health centers, shelters, city agencies, and others, looking to us for medical advice, equipment, medicines, and supplies. The shelters face some of the most difficult challenges. Think vulnerable population in very close quarters during a pandemic. Hospitals in Boston had limited PPE at the time. The shelters had none. It's hard to imagine now, but the shelter staff were screening their guests for COVID, armed only with a clipboard and a questionnaire. Nobody even had masks, let alone full PPE. I was working late one evening and got a text from one of our partners, Boston Healthcare for the Homeless. The text is something like, we've tested 100 patients, they're positive but asymptomatic. We have beds for 60 of them, but we have 40 we can't place. And they would all end up in our emergency room unless I could find a safe place for them. And if they came to our ED, even though they didn't need to be in a hospital, they'd likely get admitted, exposing staff to needless risk and patients to unnecessary hospitalizations, simply because the system was once again failing. Luckily, there was a solution. The city of Boston had opened an isolation shelter about 8 miles away. All we had to do was get the patients to the new shelter. No problem, right? Nobody would drive them. Not an Uber, not an ambulance service, one taxi service that said they would take one patient at a time. That wasn't going to move 40 patients quickly. And by now it's 9 p.m., it's cold, people are hungry, they're cranky and really annoyed. And remember, they're asymptomatic, they feel fine. But they can't leave because if they leave, they'll risk infecting hundreds of patients and staff at other shelters around the city. We had people who needed a place to sleep, and I frankly needed to keep people from ending up in our emergency room. Then I remembered our hospital operates patient shuttles. So I think, great, I'll find a shuttle driver. That took longer than it should, but we find someone. We get them outfitted, head to toe, full PPE. Here's a pro tip. If you ever want to score PPE, show up in an emergency room and say, I need PPE for this guy, or you're getting 40 patients in the next 15 minutes. The driver doesn't know where the shelter is, but that's okay. I know the area, so I hop in the van. And right about then, I'm feeling really pleased with myself until I realize I don't have a mask. Remember, I'm solidly in the risk group, and my van driver will have to make a bunch of crowded runs before we get all the guests settled for the night. And I get really, really scared. In that moment, I understood viscerally what the nurses and doctors and transporters and other frontline staff at the hospital have been saying for weeks. Kate, we're not protected enough. You can't ration these masks. These are single-use masks. I'm worried about my kids, my patients, my husband, my parents. I don't think I really got it until that moment, standing outside a shelter, about to get back into a crowded van full of unmasked COVID-positive patients who were just looking for a safe place to sleep. I walked home instead of getting back into that